think about giving birth. What image comes to mind? For many, it's a woman lying on her back in a hospital bed. This position, while standard in many Western hospitals, is a relatively recent phenomenon. So why is it so common? The back-lying position, also known as the lithotomy position, became popular in the 18th and 19th centuries with the rise of medicalized childbirth. Doctors, now the primary birth attendants, found this position offered a clear view for interventions. It fit with the medical model of birth, where the process was viewed as inherently risky and needing control. However, this position is not necessarily the most natural or beneficial for women. In fact, it can actually hinder the birthing process. The back-lying position can restrict blood flow to the uterus, potentially leading to fetal distress. It can also make contractions less effective, prolonging labor. Instead of blindly accepting the back-lying position as just the way it is, it's time to question its place in modern childbirth. Women deserve to understand their options and choose the position that feels best for them. For centuries, women gave birth in a variety of upright positions: squatting, standing, kneeling, or even sitting. These postures utilize gravity, allowing the baby to descend naturally into the pelvis. In many cultures, birth was a social event, with women supporting women. They understood the power of movement and positioning. The birthing woman was free to find positions that eased her pain and facilitated the baby's descent. However, with the rise of medicalization, childbirth shifted from homes to hospitals. The introduction of forceps and other interventions led to the adoption of the lithotomy position. Women were often placed in stirrups, their legs elevated and strapped down. This position, while convenient for doctors, took away a woman's agency and control during labor. The shift to the back-lying position represents a significant change in the experience of childbirth. It's essential to understand this history to critically evaluate current practices and advocate for more woman-centered approaches. While the back-lying position has become the norm, it's crucial to weigh its advantages and disadvantages. For medical professionals, this position provides clear visibility and easier access for interventions. It allows for monitoring of the baby's heart rate and simplifies procedures like episiotomies. However, for the birthing woman, the back-lying position can pose several challenges. Lying flat on the back can compress major blood vessels, potentially reducing blood flow to the uterus and the baby. This position can also make contractions feel more painful and less effective, leading to longer labor. Furthermore, being confined to one position can increase the likelihood of interventions. Women may feel pressure to have an epidural due to increased pain or require assistance with pushing. This cascade of interventions can further medicalize the birth experience. It's vital to remember that birth is not a one-size-fits-all experience. While the back-lying position might be necessary in certain medical situations, it should not be the default. Women should have the autonomy to choose positions that feel right for their bodies and their babies. Thankfully, there are many alternative positions that can make labor more comfortable and efficient. Upright positions, such as standing, squatting, or kneeling, utilize gravity to help the baby descend. These postures can also widen the pelvic opening, giving the baby more room to navigate the birth canal. Side lying is another option that can reduce back pain and promote relaxation. It also avoids pressure on major blood vessels, ensuring optimal blood flow to the baby. Birthing balls can also be helpful tools, allowing women to rock their pelvis and find positions that ease discomfort. Choosing the right birthing position is a personal decision. What works for one woman may not work for another. It's essential to experiment with different positions during labor and find what feels best. Remember, communication is key. Talk to your healthcare provider about your preferences and explore the options available to you. By understanding the benefits and drawbacks of different positions, you can make informed choices that empower you during your birthing journey.